All right, we are set up. Hey, good morning, everyone. Or it's afternoon, actually. It's afternoon for me. It doesn't mean it's afternoon where you are. I have to keep remembering that. You guys are so amazing. You're coming in from all over the place, which I love. And we turn that off. Good, we got a recording going. So perfect, great. Hello. Hi, everyone.
Hello.
I'm so glad that you're here. I'm happy to be here. I just got here in the nick of time, by the way. Hi, Diane. I see you coming in on camera. It's nice to see a shining face. Hi. It's nice to see you. It's been a minute. I'm glad you're here.
I was on vacation when I got to join you last time, and then I've been working, so I've been trying to schedule to have off this time frame, but it's been hard. So
Oh, I love that you're trying to schedule it into your day, though, to be here live. That's amazing. I'm honored and excited to have you. And you can always catch a replay too, right? A lot of people ask me that. You can always catch the replay. I keep them on the YouTube channel for about 2 weeks. So you're welcome at any time to go back and catch a replay for sure. I don't want you to miss anything good. My pup's decided that right here is where he needs to be. So if you guys hear all that scurrying, that's him. So I'm glad that you're here. I'm glad everyone's here. For those of you who are off camera, perfect. Everyone's being, we're being recorded. We're recording this so that we can have that replay that we just talked about with Diane, right? So that you guys can all watch this again. So if you don't want to be captured on film, just keep yourself off camera. And if you want to interact with me anyway, you're welcome to do that. Do that over chat, or you can unmute and just, talk if you don't mind your voice being recorded. And poof, that just like that, she's gone. That's all right. I know you're still here, Diane. Perfect. So for those I haven't met before, I'm Gina Schatz. I'm the developer of the Schatz Method, which is a blended movement and manual practice for all movement and manual practitioners. It's exactly how I work clinically. I developed the method working clinically. It's what I was looking for to get folks out of pain permanently and restore function to 100%. So that's what I've got going on. And so when I come here on Tuesdays to meet with all of you, which is like one of my favorite times of the week, I'm not even joking. What I'd like to offer in that window of time is an aspect of functional movement, or an aspect of body work, or even something that I do clinically. And I'll share and riff about that for about 20 or 30 minutes. And then the last 30 minutes is for you. So you get to ask any questions that are on your mind, any client questions or anatomy questions or training questions, or if you're in another training and you don't understand something, or you're trying to implement something. All questions is the point. All questions are good. And if you want to be hot seated, which I love, by the way, you just come off film and off mute, and we'll talk it out, you and me. So we've done that in the past. For those of you who've watched replays, you've seen that in the replays, and those are always super fun. So welcome to everyone who's here. Miri is coming in. Asia, I'm just going to ask you to mute just so that we can have a real clean audio background. And Mary's coming in. Betsy, hi. Diane, we said hello. Jane, I'm glad you're here. Asma, also happy to have you. Hi, everybody. Hello. It's great to have you all here. Hi. Hey, Mary, I don't think I've met you before. Have we met? You're muted.
I'm one of Marnie's students from a couple of years ago.
Oh, that's why your name is familiar. Yeah, your face and your name are both familiar, but I know that I hadn't. Anyway, hi, I'm glad you're here.
Nice to see you too.
Thank you. So you're teaching yoga?
I do a little bit of yoga teaching, but not big classes, more private stuff.
Perfect. That's what I do too. I love it. Well, I'm glad that you're here, Mary. So feel free to ask any questions. I'm going to share some anatomy wisdom here for like the first 20 or 30 minutes, probably till about halfway after the hour. And then it's all questions land after that. Okay.
Okay.
Awesome. So thanks everybody for being here. I just want to check to make sure there's no one in the waiting room. Okay, cool. So I'm super excited. I shared with you guys in the email a topic that I wanted to talk about today. And this one's really important for anyone who's working with muscle strength, building muscle strength, any movement practices, and any functional or rehab that you're doing. So wherever you are on that spectrum, if you're working with clients, this is a really important topic because it really spans all of that. The topic being what alignment means to muscle strength and function, and which one should we focus on first. Should we focus on function? Should we focus on muscle strength? Should we focus on alignment, and why? So this is one of those formulas I found clinically, and I still find it to be true, that when you get this formula and you believe it and then you follow it, it gets clarity every time. It gets clarity every time. So I'm going to give you the formula first, and I'm going to walk us through what the formula is and why. Okay. So the formula is this 3-part formula: alignment first. And when I mean alignment, I mean joint alignment, the way the body's designed, not like alignment in a yoga pose or alignment while we're bench pressing. So alignment of the structure first. That also includes whether the structure is misaligned, and what do we do about that? Do we do chiropractic? Do we do Schatz Method? Schatz Method, we do work on aligning the structure. We don't do chiropractic work. It's not high velocity, high impact, but we do work on aligning the structure. Some bodies need support around alignment of the structure. Some bodies, physical bodies, are just working on a compensation pattern or a recruitment pattern, and they need support on alignment. So either refer them out to someone who does that if you're not trained to do it, or get to it and know that that is first. Alignment of the structure is first. Then it's strength. So strengthening the muscles is super important when we're working to restore function. And I'm going to appeal to you today that we can't effectively strengthen the muscles unless we're in alignment. The structure must be aligned for the muscles to be able to be strengthened. And the way they strengthen is through all of the anatomy principles that we've talked about so far. Movement happens at a joint, muscles move bone, stretching doesn't exist, all of those goodies. And then the third part of the formula is function. Either put the body back into function, restore the function, or figure out what's impeding the function and work on that. Now, that would be something other than alignment. So alignment or lack of alignment can impede function, but we're assuming once you get to step 3 that the structure is aligned. Okay. And so then there might be other functional reasons outside of alignment that may prevent someone from being able to exhibit optimal function. And so that's its own piece, right? Like optimizing function. And sometimes what happens when we are movement practitioners is we get hung up on this third step about restoring function or just function and forget about the restoration part of it, or we don't know how to do the restoration part of it. And we work on how the pose should look and how they should lift the weights and how much weight and back off and stretch more. And we're like into the function part of it, which is 3 steps removed from where we need to be in order to have optimal function. And that is alignment first. So I'm like kind of already appealing, like and hoping to enroll you in this formula. But the formula again is 3 parts: structural alignment, muscle strength, and then function. And each of those 3 parts of the equation have a few different considerations. So let's go back to the beginning. Alignment, structural alignment. So in cases where you really do need to like get correction on the alignment, either through chiropractic work or through the Schatz Method, if that needs to happen, that needs to happen. And you're not really doing your client and student a favor by getting them to move, forcing them to move, or adding weights or trying to get them stronger if you know that their structure is out of alignment. So for example, the sacrum is the keystone of the entire structure of the body. If the sacrum is out of alignment, nothing else can be in alignment, which means then if you follow the formula, optimal function can't really exist. You can get around it, you can kind of try, you can get a hybrid of it, but you can't get optimal alignment with an out of alignment sacrum. If you love the sacrum, like I love the sacrum, then I highly recommend that you get your nose into that training, sacred sacrum. There's other places that teach it. I teach it because it's the keystone of the structure of the body, and it's a huge piece that we cover in the Schatz Method. So of course we talk about the sacrum, and of course I have a class on that. And I just have to give a shout out here to one of my mastery graduates. One of my mastery practitioners just gave me the most beautiful piece of artwork. It's just a little bit out of reach. I would show it to you. You know what? I'm going to show it to you. I'm going to show you this artwork that I just got. I'm going to show you this beautiful piece of artwork that I just got. I haven't hung it up yet, which is why I can still show it to you because I just got this. One of my graduates from my mastery program gave me the most beautiful Christmas gift. Look at this gorgeous piece of art. This is a hand-drawn sacrum and vertebral column. I mean, this might not wow you like it wows me. It should though, because you're all here and you're anatomy geeks like me. Oh my God, my heart sings. And and the cool thing, she taught me how to hang it where I can like move it to different places. I can't even wait. So we're big here in the Schatz method. We're big here on sacrum. Big on sacrum. That doesn't mean though that it's the only place to look, right? So if we're thinking about this step one of this formula of our alignment first, then strength, then function, it can also mean just where is your body in space? Where is your structure in space? So there's two things to consider. One is the body out of alignment and it needs corrective work through chiropractic or Schatz method work? If the answer is yes, great, go take care of that. Don't make your client lift weights and move in funky ways because they're not going to be able to with ease, and potentially you can create an injury. Whenever there's not ease, it's a setup for a potential for injury. We don't want to be in injury land unless we're here to heal it, right? Okay, that aside, so I told you that each one of these steps has a few things to consider. That aside, if we just don't have our bones in an optimal alignment when we are bearing weight or moving, then we can't strengthen and our movement could potentially lead to an injury. So what I mean by that is, let's say, for example, I'm going to move my hair here out of the way. Let's say, for example, I'm working on my shoulders. Okay. Let's say that I want to strengthen pec major. Okay. I want to strengthen this muscle right here. I know that in order to do that, I need to go through the action of what that muscle is. And if you still need to learn that or review it, totally cool. Dive into muscles and movements so that you know what the muscles do, so that you know which one to call on to get the action to happen. So if I want to strengthen pec major, and I know that that action is adduction of the shoulder, right? And I'm going to move my body into that place to strengthen this muscle, strengthening being step two, not step one, step two of our formula. In order for me to get this muscle to strengthen, the bones have to be in the right place for the origin and insertion to have a chance at strengthening. Okay, so if instead of me having an upright posture, I have protracted scapula and medially rotated shoulders, if I'm going to go work on this muscle right here, the bones aren't even aligned in a place that allows me to have full length and full strength in that muscle. So it doesn't matter if I know what muscle does that, the action of the strengthening. It doesn't matter if I know I'm targeting pec major. If the bones are arranged in a position where the origin and insertion are not in their neutral place, then we can't get the muscle spindles to contract and stack and lengthen and pull away. We talked about that last week and the week before as well. So step one of the formula is the bones must be in alignment, in a neutral place, the way we are designed. And then we go to strengthen them, right? So if I do want to strengthen pec major and my bones are in the right place for me to do that, where there's equal distance and neutrality between origin and insertion, then I just get that muscle to do its job. I move the insertion towards the origin and I keep doing that and reversing the lever system. We've also talked about that because that's also another anatomy principle. We've talked about that a few times. It's in your guide. I feel like I'm talking super fast right now. I need to maybe take a breath. I'm going to do that. I'm going to slow down. Right. So if I want to strengthen this muscle, I need to know where the origin and insertion is and then make that action occur through using the lever system and action being contraction. Okay. So I feel like this formula, I just clicked why I'm talking so fast. This formula, alignment, strength, and function, is literally the outline for almost everything I teach. Almost everything I teach. Yes, the sacrum is a huge focal point of alignment and function for sure. And this formula includes all of the steps that we go through in our method and all of the places where we find where we can be in effect to make this body either restore its function, get out of pain, or both, right? So that's why I'm talking so fast, because I'm doing a kitchen sink on you. I'm throwing it all in there. Okay. So if I want to strengthen pec major, I need to know where the muscle is. I need to know where its origin and insertion is. And I need to know the joint action that it does. And when I take that joint back into that action, that insertion and origin of that muscle should move towards each other and the muscle gets stronger. If the muscle doesn't get stronger, it's probably because there's an imbalance in the lever system, which is still muscle action. So one side of the lever system contracts while the other side of the lever system lengthens. And then we work on strengthening muscles by equal length and equal strength. That's our balance, right? And that sets us up for optimal function. If though we get into a conversation about, well, this muscle isn't strengthening, this muscle isn't strengthening, I need to add more weight or add more reps, which is a real common thing that personal trainers do. I actually have a client who said that he hired a new personal trainer who's in beast mode so that he could actually get his shoulders and his chest to increase in muscle strength and density. The problem is that he has probably the most protracted scapula I've seen in a while, and a little bit of an excessive kyphotic curve in his thoracic cavity, which means his bones aren't set up in an aligned way for all of that extra weight to do anything. So we can't get that muscle to strengthen and bulk up unless we have an alignment that is neutral for that lever system to actually work. What ends up happening then is if a muscle isn't strengthening, like this pec major on this client or in any of our clients really, a common, I guess, misdemeanor is the word that comes to mind, is to add more weight or add more reps. But if I'm still in this aligned position and the origin and insertion are this distance from each other instead of this distance from each other, then adding more weight isn't going to make the muscle contract more. In fact, the opposite, because when my origin and insertion are closer together, I already have shortened tissues. The only way I can make that muscle stronger is if I have length first. You can't contract a muscle that's already contracted. The only thing you can do to a muscle that's contracted is lengthen it and then go back to contracting it. It's like a seesaw. It's this beautiful balance, this seesaw back and forth. So if I'm in this position, alignment, and I'm targeting this muscle with action, and I'm only adding more weight, that's not necessarily making that muscle stronger. In fact, because of the misalignment and the excess weight, I'm in a prime setup for injury. And sure enough, that's how I got this client, because they hurt their neck, because the muscles that attach the neck to the shoulder were in a contracted place, and they were recruiting for the muscle here that wasn't doing the extra weight bearing, because they were adding beast mode weight to try to strengthen the pecs and the shoulders. That's not how that works out, because there wasn't alignment as the base of that. Okay, so that's like a what not to do. So we have alignment first, then we're going to strengthen these pecs, and now I'm going to go into function. Perfect. So now I have this alignment. We could use this client or any other person, any other client or student that you have, and I'm working with this person to get them balance, strength, and function in their shoulder. And maybe I'm even doing some rehab work with them. It doesn't matter, because it's the same formula. But once we know that our alignment is optimal and we are targeting the actual muscle that's meant to do the job and it's working, key, then we can get into looking at the function, and the function would then allow us to see if or what would be in the way if that muscle wasn't able to do its job, or it wasn't strengthening, or we notice, for example, we see this all the time as yoga teachers. We ask a body to do a certain thing and it will do it, but it'll do this other thing at the same time. And we're like, no, like drop the shoulders, just do this other thing. Pilates teachers see this, dancers see this, yogis see this all the time. When we're recruiting in that way, that's a function imbalance. And so what the body's really telling us is that muscle that we're targeting to do the job either has a pattern of not doing the job, it's not strong enough to do the job, or it needs to be retaught, repatterned on how to do the job. And if we don't catch that repatterning piece, what we'll end up doing with repetitive motion is creating another injury, because now we have this other thing going on in the body that's not part of that function that came along for the ride. And so now we created this other problem by trying to move this part of the body, right? So we want to be able to really know what is the function, what is the movement supposed to look like? Meaning, what is the optimal function of that area of the body? And is the body doing it? And if not, why? And sometimes it's because we got to go back to the beginning of the equation. Are they in alignment? Are they holding their bones in the place to be able to create that function? If the answer is yes, great. Check that one off. Go to the next step of the formula. Is the muscle contracting? And if it is, or are you using the right muscle to do that action? And if the muscle is contracting and you are using the right muscle to do the actual action, then you start looking at what's impeding the function. And that goes into, again, all the things we've talked about already. Is it a lever system issue? Is it a strength issue? Is it is there patterning from an old way of doing this particular function that we need to slow down? Not like me right now, and take a breath and have them more slowly go through the action instead of rushing through it, which will take, the faster we go, the more our brain is on autopilot, right? The more our motor skills are from a previous pattern. That's great if the previous pattern is exactly what our body needs. If the previous pattern is only what our body needed at the time, because it was in a rehab situation, it had to kind of like distort things a little bit, then that's no longer appropriate now. And we get to retrain through our neural pathways. We get to use our neuroplasticity to repattern the body on how to do something. Just because we get the body back into alignment and we get the muscle stronger doesn't mean the function is going to come right back like that without a little bit of interception. It will come back because our body is designed to move optimally. However, if we've been borrowing another pattern for a while that's not optimal, we need to reprogram that. We call it repatterning in our method. So sometimes we get into well, there's something wrong with this movement, so I must make the body do it differently. And when we just keep like Groundhog's Daying our movement, just do it this way, drop the shoulders, do it this way, drop the shoulders, or whatever it is that we're asking someone to stop doing in their function. Or like I said, even more scarily, we add more weight. We add more external weight to try to get them stronger to do the function. And oftentimes it's just like, are they aligned to even do it in the first place, right? So at any one of those stages, there's a lot to consider. And I can't emphasize enough the order of those steps. So again, alignment, then strength, then function. Okay, I got it in 20 minutes. There was a lot to cover. I hope that makes sense. I hope that serves you. I hope it's clicking and making some wheels turn for you so that you have some ideas of like, oh, maybe I want to try it this way with this client, or maybe I want to do it differently or switch things up a little bit. And I just want to emphasize here as well that every time I share about something for us as practitioners, it's never just for a movement practitioner or a manual practitioner, right? Because here's the thing. If I have a client who's coming to me with pain and discomfort, and I'm a manual practitioner, their pain and discomfort came from some function. So I need to know how they're moving and what is supposed to happen when they move and what's not happening when they move. And I need to know what they're up to in their movement life. If I'm a manual practitioner, are they doing yoga? Are they doing Pilates? Are they weight training? Right? This client that came to me with neck pain, it wasn't in his neck. And then as I was starting to hear more about what was going, I didn't think it was in his neck when we started, although he was positive that's where the pain was. But we all know that 80% of the pain in the body is referred from somewhere else. So I didn't think it was in his neck because out of the gate, he's telling me he has neck pain, but I know the equation. So I was asking some questions, and sure enough, what are you up to in your movement life? What are you doing? Oh, I just got this new trainer. We're in beast mode, blah, blah, blah. Aha, okay. Well, now I hear that the strength and the alignment is not not working. You're coming to me for manual work, but your function's off. So I get to help you with your function, dear client of mine, while you go back to your personal trainer and work out with them. I totally want to do that. I don't need to be a personal trainer. I mean, I'm trained as one, but I'm not doing that currently clinically. I don't need to. I want you to have your own trainer. I can't see everybody. Right? There's more people that need us than there are of us to serve. So of course I want you to have your massage therapist and your trainer and your Pilates person. And of course. And if I'm here only doing the manual work, I need to know what the function is. So I know what caused the pain in the first place. Otherwise, I'm not really serving my client to rub out the muscles that are sore get them out of pain for an hour or two until they go back to working out. Like, I haven't served them if I've done that. And the same thing is for movement people, right? If you are not a manual practitioner and you think you can't get rid of someone's pain because you don't work on them manually, I totally get that. Again, there is some real skill in manual practitioners, and you should have one in your network to refer to. That said, the movement is still on you if they're moving with you, right? So we want to know these 3 steps, these 3 steps of the formula, so that we can help our clients move in a way that is efficient. And here's the key. Here's the golden cherry on top of the sundae. Because the body is designed to move, optimal movement will always eliminate pain and restore function. It's got to be optimal, though. And that's really the basis of what we're talking about today. It's got to be optimal alignment, optimal muscle engagement, and then optimal function. And then the body is pain-free. It works magic like that every time, every time. Okay, I did. I got it all in. I got it all in, even my prelude. I'm so excited. All right, awesome. So now I get to turn the tables over to you. So what questions do you have today? It can be about something I shared or something else for sure. What questions can I support you with? Do you have client questions? Do you have fieldwork questions? Do you have anatomy questions? Anything and everything goes. And if some of you don't want to be on camera and you don't want to unmute, you're welcome to use the chat. Just type your question into the chat. They usually start coming in. I know it takes a minute or 2 to type, especially if you're on your phone, but you're welcome to use the chat, or just come off mute and start talking. Or if I can see you on camera, you can raise your hand as well. And I'm going to go around and say hello to a couple people that came in while I was talking. Mylin, it's great to see you. Rita, it's also great to see you. I'm glad you're here. Who else came in? Anita, I'm not sure if I said hello to you already. Laura, hey, it's great to see you as always. Saeed, it's great to see you too. And I think I said hi to everybody else that's here. I know there were a couple people that popped in while I was talking. Asia, if I didn't say hi to you, hello. Great to see you. Loved your teachings. Oh, Anita, thank you. I'm so glad. And Asia, you sent me such a beautiful letter, a beautiful love note about the muscles and movement course. I'm so glad you're enjoying that. Really, it's just, I was in tears when I read your note. I'll send you an email back so that I can officially thank you. But I was totally choked up when I read your note about that course. Hey, Asia, it's nice to see you.
Studio. Okay, here we go.
Here we go.
Yes, that course is heaven sent. I'm still going through it, but all I can say is I get it, because I've been independently fondling with anatomy for a long time, 3 or 4 years. And I had a piece here and a piece here and a piece here. And as I'm going through the course, it's like all these pieces are pulled together into this one unit of understanding. So it's awesome, and I recommend it to everyone. But thank you for acknowledging the love note.
Oh, Asia, that's so great. I'm so glad it's working for you. And when you say the pieces are coming together, what pieces and how are they coming together for you? Do you mind sharing?
Oh, I don't mind at all. So, in your magic, how you explain it, the origins and the insertions and the movement, that all comes together with you go through the origin insertion, you speak to the Latin, and then you speak to the lay. The speaking to the Latin and speaking to the lay, that is a major dot connector for me. And then after that segment, I forget what the name of it is, but it's a different segment. And then you take the anatomy and then you apply it to real life movements that we do. So when you have this learning objective and then you have this application of it, it sticks.
Yes.
So that's how I get it. And then you do a round robin of everybody, and everybody share how they digest the information. And that's very helpful, because I'm like, that's exactly what I was thinking. So it's all one big ball of good information. So I love it.
Asia, that's such a great description of that course. And I love that it came from you and not me. Yes, 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 yes. And I love that you're loving it. And all those pieces we put in there on purpose, right? Like I hear you that sometimes even when it's rote information, like memorizing muscles, it's still, we want some dimension when we're learning. Like our brain is really a creative place. And so we want some creativity around that. You're welcome, Anita. And then once we have the knowledge, we have to implement it for it to actually kinesthetically stick, right? So whether we're movement or manual practitioners, we're kinesthetic. Like we want it to be an experience. And so that was designed purposely in that course. All my courses are like that, where we have we call it skill building, where we actually implement what we're doing as part of the training. And I feel like it is an accelerator. So I'm so glad that my opinion about that is actually your experience, because that matters to me a lot. I'm so glad. Yay. Awesome. So Asia, do you have a question today, or did you just come on to share more love? Because
I can do both. I had a question. I was sharing that. And then the 3-part formula. So the alignment, the strengthening, and then the function.
Mm-hmm.
So just to make sure I understand, those 3 tiers come together to restore the body to optimum function. Is that how it works? I think.
Yep, you're right on there. Those three parts of the formula are needed for a couple reasons. One of them is to create optimal function without the potential for injury. So like when I was using the example of sometimes as a personal trainer, we might add too much weight to try to get bulk in a muscle, but then we're actually heading them towards injury. Or even in a yoga practice, we try to get them to do the movement, but they're doing it in a way that's not optimally, based for their body. And then ultimately, then they end up injured. So it prevents injury by moving in those ways. It can also, though, restore injury. And in all cases, it is an eliminator of pain, meaning either preventing it and not letting it come, or it gets rid of it if it's been there. And not, hey, I see you. Like you're like such a hungry student, Asia. I love it. I could just talk to you all day. So when we don't have one of those 3 steps, we are not getting to our end result, which in my land is, alleviating pain, right? That's my focus in the world. That's my vision quest, right? To make sure that we can all live pain-free while moving and experiencing a great relationship with our body. And sometimes we get to a place where we forget that those 2 things can be, simultaneously happening. So in my world, that's always my lens. Like, how can I get this person to move with their optimal freedom in their body and enjoyment, and either be pain-free because we're eliminating pain, or we're preventing it from ever coming while they're moving freely like that. Like the idea where we're like, well, I worked out for 6 weeks, and right at the 6-week mark, you end up having a bunch of clients that drop off because they're injured. Does that happen to you? Yeah, it's like really common in any movement practice. And it's a little bit shorter when there's weight bearing, external weight bearing instead of their own body weight bearing. And the idea is that we can stop that routine. That schedule is not mandatory. It's common, but it's not mandatory. And it's common because of the missing pieces of this formula. So if someone's working out and they're on a new workout routine, but their alignment while they're working out isn't optimal, they're going to end up injured. If someone's in a new workout routine and their body structure is aligned, but they're adding, too much weight or too much torque in tissues that have been previously injured, just because their alignment is good, they're still in a setup for injury, because you need to work with the function, which is step 3 in that formula. And if there is no previous injury and their muscles are just, really needing some strength, but they're not optimally aligned, not from what you're cueing them as a practitioner, but like they have misalignments in their structure. That's what I said at the beginning. Like you need to have, either, a manual practitioner, like the Schatz Method that's one of the biggest things we do, is we work on aligning the structure. Or if someone needs chiropractic, if their joints are, just not movable, that's when high velocity and high impact comes in. There's different applications for different types of corrections. I don't want to get too squirreled on that. The point is, You might have them with perfect form, like a personal trainer would call it form, a yoga teacher would call it alignment. You might have it where it's stellar. Your visual assessment is spot on. You can actually see what they're doing, but you don't know that on the inside their spine is torqued or their sacrum is tilted. And so then you have them weight bearing on top of a frame that can't be working the lever system because the frame is out of alignment. So you know, you need to have a way to know that, you know, and again, not every practice teaches that. It's one of the big reasons why we teach it, so that you can know, even if you're not going to be the one doing the work, you can know not to do what you're about to do, which is going to cause them pain, right? So those three pieces are really important if you're working on, yes, optimizing function, restoring function, and always averting or alleviating pain.
Wonderful, thank you.
My pleasure, Asia. Hey, Mary, I see your hands up.
Yeah, so I'm interested if somebody has, say, a somatic dysfunction where their sacrum is, you know, they say their one leg is longer than the other, or there's something with their bones themselves that it's kind of not what would be normally aligned. And what sort of approach could you take with them?
So great question, Mary. Curious. I want a little more clarity. When you say it's a somatic dysfunction, is that where are you getting that term from? Why somatic and not like genetic or developmental?
I just have seen it, like I've just seen that before. Maybe I'm not using it. I don't know as much as you, Gina. So I'm just
no.
Yeah.
I'm not challenging you. I just want to make sure I heard your question. I really just was.
I mean, I just mean some sort of something where they can be realigned, but then they kind of slip back because say it's a chronic matter.
Okay.
And
so
some people do have like one leg longer than the other, for example. You know, so how do you deal with that?
Yep, it's a great question. Now I'm understanding it more. So first off, if you are in Groundhog's Day where someone does get aligned and then they slip back, which were your words, to me, and for all of us, I would love for you to know that means that what you're doing is close and not complete for what they need. Because the key for that one, Mary, is that they got aligned and then they slipped back, right? If you can't ever get them aligned, that's a different, it's a different approach. So that's step one. The other thing that's really helpful when I learned this is so helpful is that leg length discrepancies, like actual leg length discrepancies, are far less common than we think they are. But a lot of people will say my leg is longer than the other. And if you ask them how they know, and they say it's because when I get my pants hemmed, my one leg is always longer than the other, that doesn't necessarily mean that the actual bone grew a centimeter longer than the other one. It can for sure. And in instances like, you know, some diseases like polio, you know, bones do change, or osteoarthritis, bones do change for sure. So what I'm saying is that it happens much less frequently than we think. Most of the time, a leg length discrepancy is a quadratus lumborum function issue, because that's a hip hiker. So if someone's QL is shortened on one side because they move bilaterally, then it can look like the whole side is shorter than the other. But if you're not actually measuring the bones themselves, you'll just work with leg length discrepancy as the sort of premise and kind of miss the genesis of it. So I used to keep a tape measure. I still do keep a tape measure in my office. I haven't used one in a really long time. That's why I said used to, but I would literally measure from their ASIS to the malleoli, and I would have them remember the number, and then I'd go to the other leg and measure it again so that they didn't think I was tinkering with the numbers or anything. And 99% of the time it was the exact same number, but they did have a hem higher on one pant leg than the other. So what's the answer? It's in their back. It's in their function in their low back. And so again, as we're thinking about like, you get them aligned and then they slip back, and you get them aligned and they slip back, did we work on restoring the function in that place enough to restore full function bilaterally on the QL? And if the answer is I'm not sure, then great, go back there and do it again. In the instances though, where there really is a leg length discrepancy and you know, that's not what I heard you say because you got them there and then they slipped back. But if there really is a leg length discrepancy, like I have had clients who've had, you know, orthopedically made shoes where the sole is actually larger than the other because they had a, you know, a disease as a child or a car accident and they broke their leg or something like that. Back in the days when orthopedic surgery didn't always make them even at the end. And in those instances, it's even more important to follow the formula, because that means that with every step they take, they are walking themselves into a pattern that can create injury, which means we must keep them aligned. They get more body work than the average bear. They get more strengthening from an aligned perspective than the average bear. And we work on their function like it's their full-time job. And yeah, it might be, you know, to some people that might sound like a bummer, but that's just what they're working on in this lifetime. That's okay. We all have something in our body we're working on. None of us gets off scot-free. Like this is a full-time job, this thing that we're all walking around in. Did that answer your question, Mary? Did that give you what you wanted?
It did. I had the question just to follow up though about the sacrum in particular, since that's
Sure.
like the core.
Mhm.
So, can you just talk a little bit about that? Like if that can be aligned, but then it slips out of alignment. And then what would be the piece that could maybe, once it is aligned, hold it better in that alignment?
Yeah, it's not too different than the formula we just talked about, right? So we want to get the sacrum into alignment, figure out what caused it to be out of alignment in the first place, if you're able to, get it back into alignment, strengthen it there, and then get the body back into function so that the sacrum knows where its place is while your body is in movement. So if, for example, the sacrum has a torque or a tilt in it, we want to work on getting that back into alignment, which you can do as a practitioner. You don't have to be a chiropractor, like I said. There's other things that chiropractors need to work on that we can't, for sure, and vice versa. So let's say the sacrum's torqued or tilted, we get it back into alignment. Then we get to strengthen the muscles around the sacrum. And that's one of the reasons why it's really helpful to figure out, why was it out in the first place? Which muscle was the cause of that sacrum getting into trouble? Was it not doing its job? Was it overworking? Was one side, meaning one hip, doing something different than the other hip? And because the sacrum toggles both hips, it got pulled into one direction because one side was doing muscularly something different than the other side. What caused it? And then equal the strength out so that both sides of the sacrum have equal chances of being held in position. Then take them back into their function, even walking. Are they using both hips the same when they walk? If they're not, and they're dragging one foot, or they're only contracting one glute max while they're walking, guess what? Glute max attaches to the sacrum. That means that while they're walking, they're pulling on one side of the sacrum and not the other. It's going to lead them back out of alignment just by walking back to their car. So that's one of the easiest ways that we work. That's like literally right out of our textbook, right? Like that's how we work in the method to address the sacrum. There's other things that can be happening too. Like there can be hypermobility. We've talked about mobility in the last couple of weeks. And if someone's hypermobile, then their ligaments are more free flowing, like a hammock blowing in the wind. And so in those instances, there isn't as much structural support for the sacrum to be held in place, which makes it mandatory that they double down on their muscle strength. And in order to do that safely, they've got to be aligned first because of the formula that we just talked about. So I can talk you through like a couple different scenarios. Each one of them have clear steps, but they're steps to that. Did that answer you? Is there something more that you want, or is that it's good? Okay, great. Yay. What a great question. I love it. What are the main muscles that pull the sacrum out of alignment? Mylene, I love your question. And my mastery practitioners would pass out right now if I gave you the answers because they make them work for it. So it's part of what we do in our program. It's called probable cause, and it's like the hardest part for them sometimes. And so I can't just give you the answers because that would be so cruel if I gave you the answers and not them. But this is what I will share with you. You'll know which muscles pull the sacrum out of alignment if you look at where do they attach, what action do they do, and does that action involve the sacrum or require the sacrum to be stable for the action to occur? And that's basically every posterior hip movement and some anterior hip movements and a few lower extremity movements too. I'll give you that. So if you know your muscles in movement, then you'll know what muscles are doing what the movement is, and then you can kind of piece it back together. And that's exactly how I walk them how to do that through the program. So I hope that satisfies you. Diane, I see your question here. Let me read it though. Oh, Mary, give me 1 second. Diane sent this question in so long ago. Stretching doesn't exist. Yes, that's true. If you're bringing the antagonist together to stretch the agonist, is it with or without weight? If you're doing a tricep strengthening by bringing the tricep attachments together, exactly, is it with or without weights or either? It's either, Diane. So stretching doesn't exist is one of our anatomy principles. Yes, it's in the guide. I hope you all got your guide. That's my gift to you. Please enjoy that. Stretching doesn't exist, and the lever system does exist. And so just as you're talking it out right here, in order to contract one, the contraction is always the agonist, the action is in the agonist, and the antagonist is what is lengthening in the lever system. Then when you flip it, and the antagonist is what you're strengthening, because it's contracting, it now becomes the agonist on the lever system. So they're like two-faced, like they flip IDs easily like that. And that lever system, one strengthening in the opposite lengthening, and then that one strengthening in the opposite lengthening, that formula of lever system happens with or without weights. Okay. And it can be with or without weight bearing your own body weight as well. I hope that answered you, Diane. Mary, I'm back to you. Get a follow up?
I just wondered, can the sacrum though can impact the whole upper back going all the way up to the neck, correct?
The keystone is the sacrum. It affects everything. Every single thing. And like all things, its proximity matters as well. So not only does the sacrum affect all four curves of the spine, it also affects the cranium and from the cranium down, and that's through cranial sacral law. And we talk about that in a few different courses as well, because it's worth it to just keep repeating it. Like, how does that all happen? In Sacred Sacrum, we talk about how it's connected to everything and how all parts point back to it and why it is the keystone. We talk about, there's some ideas that, alignment starts from the occiput down. I get that. And there's also some theories that talk about alignment starts from the arches of the feet up. I also get that. And in that course, we talk about why it still always is the sacrum, though. Even though those other two things are valid, how are they valid and where do they stop? And where is the sacrum valid and how is it completely encompassing all of those theories, why it's involved in every single one of them. And then we talk about some clinical experiences and some, empirical data that I share too. So the sacrum does, yes, bottom line, to your point, Mary, it affects everything structurally in the body. Has to. Axial or appendicular and everything in between, including the nervous system because of the spinal cord and its relationship to the sacrum. Yeah. Are you hot on the trail of a sacrum, Mary? Are you flirting with sacrums right now? Because it makes me super happy. Kind of. Oops, you're muted.
Yeah, I just was kind of interested in the whole sacrum thing. And
yeah.
You're the expert, so it's great to talk to you.
Oh, I love talking about it. So thanks for giving me airtime. Yeah, sacrum I could talk about all day. That's why I showed you guys my gift. Isn't that like the most beautiful piece of artwork? I'm so excited. I can't wait to. Awesome. Okay, these are super juicy questions, you guys. Any other? Hey, Rita, I see your hands up. You're muted. I'd love to hear you.
Can you hear me?
I sure
great.
can.
Thank you so much. I'm very much enjoying your lecture. I have a question. I'm trying to sign up for the Sroth exercises at the Hospital for Special Surgery. How does that compare with what you do?
I'm sorry, which types of exercises?
The Sroth, S-R-O-T-H, I think it is.
I'm not sure. I don't.
Sroth, yeah. It was developed in Germany, and Hospital for Special Surgery have people who specialize in it. And I was told by my spine doctor to sign up for it.
Mm-hmm. So I'm familiar with Hospitals for Special Surgery. It's in New York, right?
Yes.
Yeah, I'm familiar with them. I did do some collaborating with some practitioners there, and I know that there's a lot of similarities in my method and what they do there. I trust that you're in really good hands. That particular technique, I'm not familiar with, so I'd have to look at it to give you a more honest answer, more intelligent answer.
Right.
Can you tell me what the exercises, what the goal is? Like, what are you trying to accomplish there with those exercises?
Well, I guess it's to relieve the curvature that I have, the
Which
scoliosis.
Okay.
I have scoliosis. I also have a little bit of kyphosis. And I do have one leg that looks shorter than the other, but it's not related to the legs. Okay.
Right. Yeah. So I'll tell you what we do in my method for a scoliotic curve and an apparent leg length discrepancy that's probably from your low back. And then you can use that information. And then you haven't gone in for exercises yet, Rita?
No, I haven't even signed up yet, but I'm just trying to.
Oh, okay. So you can maybe use this to ask them more questions, or you can, compare. Okay, Diane, it's great to have you. See you next time. Or you can, compare what it sounds like I do to what you're actually doing there if you go forward with with an exercise program with them. So what we do for scoliosis is back to like what Mylin asked us, what is actually causing the misalignment? What muscles are probably causing that to happen? And in a situation like scoliosis, it is, largely the paraspinals, right? And all of them, some of them hold the spine upright, which would mean that there would need to, not be a curve. And some of them rotate the spine, which would be part of the rotation in the curve. And then if your scoliosis is an S curve this way, then there's, some that aren't doing the erectors, right? Aren't lengthening in all the segments along the spine. And it gets a little bit tricky, truthfully, in scoliotic probable cause, because each paraspinal has a short span that it covers. So there's lots of different muscle segments, which is why a scoliotic curve can happen, because this part of the spine, and even though it's the same muscle up here as it is down here, only this segment is in trouble. So it's pulling this part of the spine into a different formation, even though this part of the spine muscles they're fine, like they're okay. And in the body, diagonals are always present because the body wants us to stay upright, opposing gravity. So if my spine is being pulled in this direction, notice how as I'm pulling my spine in this direction, see how my head went in that direction? And if I pull my spine in this direction, my head goes that way. The reason is so that I can stay upright. Otherwise, if I pulled this way and everything went that way, wham, I'd be gone.
Right.
So in a scoliotic curve, it's like up here is doing this and down here is doing that. And really, if you think about it just from a design perspective, it's a form of balance. And that's a good thing. So when we work with that in our method, what we work on is like the lever system. If this side is shortened, how do I get it to lengthen? In order to get that to lengthen, I need this side to contract, because contraction is the action. It's right back to the anatomy principles that we've talked about in the guide, right? Like, I don't want to stretch something. I want to contract the opposite side so that the joints are back into function. And that's ultimately what we're doing in scoliosis, is aligning the joints back into their function. So we would work on that in all the muscle segments all the way down. And we might do, a couple other things that are a little more intricate, but that's basically the premise of that. Like that's basically what we would do. And then when we get down to what looks like your leg length discrepancy, that's QL, that's core, that's obliques, and we would address them in the same way. We would need the sacrum to be aligned first so that the muscles that are just above it can balance. And then we would follow that up the spine. The key with scoliosis, depending on the amount of curve that you have and how long you've had the curve, the key to it is repetition, because like everything in the body, it's a pattern. So scoliosis at this point is a pattern that your body has adapted. And in some cases, like Allison would say, the body doesn't even recognize where north is, because the spine has been in that orientation for a while. In those instances, the clients that I work with that have scoliosis, they really need to come in like twice a week for a while so that we can like pattern interrupt, and have a chance, give them a new pattern that we can keep repeating them back to. Someone with very severe scoliosis, especially if it's been there a long time, the curve is really big and there's a lot of pain. Once a month is really like, it's just confusing. Like it's better than nothing, but it's not really going to get you your end result. And that's something that you work on with your practitioner. Did that support you, Rita? Did that answer you?
That's very informative. Thank you very, very much. And I've really gotten a lot out of today.
Oh, good. I'm so glad. And because you're in New York, Rita, I recommend too that you connect with Allison West. Have you met her yet?
Yes, I have. She gave up her studio, but she's doing it online. Yes.
That's right. Yeah, she was a speaker in our last summit, and she talked all about your question about scoliosis.
Right.
She's, as far as movement and function goes, She is a wizard at movement and function for scoliosis.
Okay.
Now, she doesn't do the alignment work, right? Like she doesn't do the functional, alignment that like we would do, or maybe what you're going to get at, with the practitioner that you're signed up for. But certainly, like I said, because scoliosis is so much of a pattern interrupt and it needs so much repetition, cross-training with two different practitioners who have the same objective and whose work doesn't conflict with each other. If it were me, I would do that. And even just talk to her, right? Like I'm happy to answer questions for you too. And she's got other information too. So, and she's in your city right now. So
Thank you. Have you also heard of a Debbie Wohl?
Spell the last name.
I think it's WOHL.
I haven't.
No. Okay, thank you.
Do you want to tell me about her? Should I know her?
No, it's just another name that was given to me, but I don't know anything about her.
Okay. She's a New York practitioner?
Yes,
Okay.
I believe, yeah.
I'll keep my ear out because you never know. It's kind of like when you buy a yellow car and then the next day you see 3 yellow cars on the road. It's kind of like that. As soon as I hear someone's name, I might hear it again. So I wrote it down. If I hear anything more, I'll reach back out to you.
Thank you so much.
Yeah, my pleasure. Okay, loves. Well, this has been super fun. I know I mentioned a lot of extra training, and I only did that in ways of support. I didn't give you guys any of the links except for the one that was asked for. But I want you to know that if you have other questions about that, of course, we're here to help you with that. Of course. And what I'll try to remember to do is in the comment section of this video in the replay, I'll go back in and recall the courses that were asked about or that I mentioned. If you want information on this, go here, and I'll put them in the comment section so that you can, look into that a little bit further. Either way, I want to let you know that I really, really honor you for being here. That for those of you who keep coming and keep showing up, that's amazing. And if your clients and students and patients haven't told you yet today how bomb ass you are, I'm here to tell you that, because they might not know that you're here investing in yourself so you can support them. But I know that you're here investing in yourself so that you can support them. And anytime we take extra training, we're continuing to not only improve ourselves, but to improve the lives of someone else, right? And so that's really, really important. As long as we've chosen the human body as our muse, our study is endless, because we will not leave this planet knowing it all. So there's never it's always the right time to dive into extra training. So that's why I'm here to support you in that quest, because I fully believe that. So I got a love note, Mylin. Love your trainings. Love solving the puzzle of the body together. Me too. It's like my favorite thing. It's my favorite thing to talk shop with you guys. So thank you again for being here and for all of your amazing questions, and so that we can all support each other. I will be here every Tuesday for the rest of this year, the rest of this calendar year, of course, into 2022 as well. But I want to let you know, people are like, is she taking the week off? No, not for you guys. I'm here every Tuesday for the rest of the year. And bring all of your questions, bring all of your love. It's a safe place for you. And in the meantime, thank you in advance and again for continuing to do amazing work out there in the world. You are helping lives, and I'm super grateful for you and your presence here. Until next Tuesday.